Ever notice how dry air can make you feel kind of, well, thirsty?
Yeah.
Like your body's just craving some moisture.
Yeah, absolutely.
We're diving deep today into a document called Humidity and Bland Aerosol.
Okay.
Sounds pretty technical, right?
It does.
It looks like something a respiratory therapist or maybe a medical student might use.
Yeah, that's right.
But have you ever thought about what happens when you can't breathe regular air? Like when you're getting medical gas.
Okay, yeah.
That's where things get a bit more complicated.
Absolutely. There's a whole science to keeping things moist when you're working with medical gases.
So let's break it down. Absolute humidity versus relative humidity. What's the difference?
Well, it all boils down to how much water is actually hanging out in the air, right?
Right.
So absolute humidity, you're talking about a direct measurement, like literally how many milligrams of water are there in a liter of air. But relative humidity, that's a bit trickier, right? It's a percentage. Think of it as a comparison. You're looking at the amount of moisture in the air compared to the maximum amount it could hold at a specific temperature.
Mm-hmm.
Now, warmer air can hold more moisture, which is why things feel so much drier in the winter, even if the actual amount of water in the air hasn't changed that much.
Oh, interesting.
Yeah.
So we measure relative humidity with those hygrometers, right?
That's right.
But we don't walk around with hygrometers attached to us.
Yeah.
So how does our body handle humidity?
Well, our bodies are pretty amazing. Our respiratory system is kind of like a built-in humidifier.
Oh, wow.
Yeah, it warms and moistens the air that we breathe. Think about it. As you inhale, right?
Mm-hmm.
The air travels down. And by the time it gets to a certain point, about 5 centimeters below the carina, that's where your trachea splits.
Okay.
It's reached body temperature, a cozy 37 degrees Celsius, and 100% relative humidity.
So there's like a sweet spot in my lungs where the air gets perfectly humidified.
You got it. We call that the isothermic saturation boundary, or ISB for short.
ISB.
Yeah. And here's what's really cool. The ISB isn't static. It's actually quite dynamic.
Oh.
Have you ever noticed how your breathing changes when it's cold outside?
Yeah, for sure.
Well, that actually affects your ISB that moves deeper into the lungs, depending on stuff like whether you're breathing through your mouth or if the air is cold.
So if I'm like breathing fast because I'm, anxious or something, my ISB has to work harder.
Yeah, pretty much.
What happens long term if your body just can't keep up with keeping the air moist enough?
Well, that's when we need a little help, right?
Right.
That's where humidity therapy comes in.
Okay.
It's especially important for patients who are on ventilators or getting oxygen therapy.
Right.
They're getting dry medical gas pumped in.
Right.
So their natural system might need a bit of a boost.
So what exactly do we mean by fully saturated air? How much water are we talking about here?
It's pretty amazing how much water fully saturated air at body temperature can hold. We're talking about 44 milligrams per liter.
Wow, that's a lot.
It is. And that's when it hits 100% relative humidity. It also has a water vapor pressure of 47 millimeters of mercury.
That's a lot to wrap my head around. So basically our body's humidity is like a percentage of that full capacity.
You got it. Think of it as a fuel gauge for your lungs, showing how much moisture is available compared to the maximum.
That's a great analogy. Makes sense. But what if the air we breathe isn't fully saturated,
Yeah.
Like, what do you call the difference between what we're getting and what our bodies actually need?
We call that the humidity deficit. It's basically that gap between what the air has and what our bodies want to function at their best.
Uh-huh.
We can measure that deficit in milligrams per liter or express it as a percentage.
Got it. So humidity therapy is kind of like bridging that gap then.
Exactly.
Why would someone actually need humidity therapy?
What?
What are the main reasons?
The primary reasons are to humidify those dry medical gases we were talking about and to make up for the loss of natural humidification when someone's upper airway is bypassed, like if they have a tracheostomy.
Okay, so we're keeping those airways happy and moist. Are there any other reasons to use humidity therapy?
Yeah, actually, there are a couple more.
Okay.
It can be really helpful for managing hypothermia.
Oh, really?
Yeah. You see, by warming the air, we can actually help raise body temperature.
Interesting.
It can also be a lifesaver for folks dealing with cold air-induced bronchospasms.
Okay.
The warmth helps relax those constricted airways.
Makes sense.
But there's a catch.
Oh.
Temperatures above 40 degrees Celsius can actually burn the airway.
Yikes.
So we got to monitor things super closely.
So let's talk about what happens if someone breathes those dry medical gases for too long. Are there serious risks involved, especially if their upper airways like bypassed.
Absolutely, especially with high-flow medical gases, anything over 4 liters per minute. They can cause a bunch of problems, like slowing down the cilia.
The cilia.
Yeah, those little hairs that help clear mucus from the airways.
Right.
So it causes irritation, makes the mucus thick and sticky.
Oh, yeah.
It's a mess. And if the upper airways bypassed, like with a tracheostomy tube, breathing dry gas can actually damage the trachea within minutes.
Oh, wow. That's scary. So how do you prevent those complications? What tools do you have?
Well, we have different types of humidifiers for different situations.
Okay.
For simple oronasal oxygen, we often use a bubble humidifier.
Okay.
It basically breaks the gas stream into tiny bubbles underwater to add moisture.
So those are kind of a basic option.
Yeah, they're only about 25% effective, and they don't work well at high flows.
Okay, so what if you need more, like, serious humidification?
Then we bring out the big guns, passover humidifiers.
Passover humidifiers.
They can deliver 100% body humidity, making them perfect for folks on ventilators or with bypassed airways. There are simple, wick, and membrane types.
Oh, wow. A whole humidifier family. What's the difference between them?
Well, simple passover humidifiers just direct the gas over a water surface.
Okay.
Wick humidifiers use a wick, obviously.
Right.
It sits in the water reservoir, and the gas flows around it, picking up moisture.
Okay.
The most advanced ones are membrane humidifiers.
What makes them so special?
They have a special membrane that only lets water vapor through, so you get really precise control over the humidity.
Okay, so you've got the humidifier set up. But how do you heat the gas? What kind of heating systems are there?
There are actually quite a few.
Really?
Yeah, you've got hot plates, wraparound heaters, yoke or collar heaters, and even immersion heaters that go right into the water.
Wow, that's a lot of options.
It really depends on the specific patient and situation, which one's best.
So how do you decide?
Some ventilators even use these fancy servo-controlled systems that constantly monitor and adjust the temperature for optimal humidity delivery.
Servo-controlled. Sounds pretty high-tech.
It is. But with all this humidification, there can be some challenges, right?
Oh, I bet.
Condensation, also known as rainout in the tubing, is probably the biggest headache.
Ugh, rain out. What causes that?
As the warm humidified gas cools down on its way to the patient, it forms water droplets in the tubing.
I hate when that happens. What's the big deal about a little condensation?
It's not just a little nuisance. It can actually block gas flow, mess with the oxygen concentration, and even create an aspiration risk if the patient inhales those droplets.
Oh, wow. I didn't realize it was that serious.
Yeah, and those droplets can become a breeding ground for bacteria, too.
Oh, no. So how do you stop condensation from forming?
There are a few things we can do. Water traps in the circuit can catch condensation before it reaches the patient.
Okay.
Heated wires can keep the gas warm to prevent droplets.
Right.
And of course, we make sure to change those circuits regularly, especially when they look, dirty.
That makes sense. So let's say you've avoided condensation. How do you make sure you're giving the patient the right amount of humidity?
Well, here's a handy trick. You can adjust the temperature until you see just a few condensation drops forming near the patient. That's a good visual cue.
Oh, that's smart. Are there specific guidelines for humidity levels?
The American National Standards Institute, or ANSI, recommends at least 30 milligrams of water vapor per liter for intubated patients. We usually achieve that with a humidifier temperature of around 35 degrees Celsius.
Good benchmarks to keep in mind. Now let's shift gears a bit and talk about those bland aerosols we mentioned earlier. What exactly are they?
So bland aerosols are basically tiny liquid particles that are suspended in a gas.
Okay.
We use them for all sorts of reasons in respiratory care.
Like what?
It depends. We might use sterile water, hypotonic saline, isotonic saline, or even hypertonic saline.
So a whole menu of options.
Yeah.
What are some of the ways you use bland aerosol therapy?
Well, it's great for mobilizing those stubborn respiratory secretions, especially for patients who have a tough time coughing.
Yeah.
We also use it after extubation or other procedures to prevent bronchospasm and inflammation.
So a soothing spa treatment for the airways.
Haha, you could say that.
What else?
We can also use it to hydrate the airways of tracheostomy patients and even to induce a cough for sputum collection when we need to analyze the mucus.
Makes sense. So how do you actually create and deliver these aerosols? What kind of devices do you use?
That's where our trusty nebulizers come in.
Okay, nebulizers. I've heard of those.
The most common one is the large volume jet nebulizer.
Okay.
It uses air pressure to pull liquid up and create the mist that the patient breathes in.
Cool. You mentioned something earlier called an artificial nose.
Oh yeah, the heat moisture exchangers, or HMEs.
HME.
They're pretty clever, actually. They capture the heat and moisture from your exhaled breath,
Okay.
and then they use it to humidify the next breath you take in.
That's amazing.
Yeah, it's like recycling your breath.
I love it. How efficient are they?
About 70% efficient, usually used for shorter periods, though.
Okay, that makes sense. So back to those nebulizers. Are there other types besides the jet nebulizer?
Yeah, there are a couple more. There are impeller nebulizers. They're pretty popular for home use because they're smaller and quieter.
Okay.
They work by using a spinning disc to fling water droplets through a baffle, creating a mist.
So they're not as powerful as the jet nebulizer?
No, and they can be a bit trickier to keep clean.
Oh, so there are some trade-offs. What about those ultrasonic nebulizers I've heard about? Those sound pretty fancy.
They are pretty high-tech. Ultrasonic nebulizers use a special device called a piezoelectric transducer that creates these high-frequency vibrations.
Okay.
And those vibrations break up the liquid into tiny, tiny particles, making a very fine mist that can really reach deep into the lungs.
So it's like a tiny earthquake for the liquid particles. What are the advantages of using that kind of nebulizer?
Well, they're really good at producing a high output of that fine mist, and they don't need any extra heat to do it.
Okay.
Plus, about 90% of those particles are the ideal size for reaching deep into the lungs.
Sounds efficient. So you've got your mist. How do you actually get it into the patient?
That depends on the patient, really. For those who can breathe on their own, we might use aerosol masks or face tents.
Okay.
For tracheostomy patients, we have special interfaces like T-bars or Briggs adapters.
Got it.
We also use tracheostomy masks or even mist tents for babies and small children.
So many options. You mentioned earlier that hypertonic saline can help mobilize secretions. How does that work exactly?
Hypertonic saline, which is usually between 3 and 10% concentration, is a short-term treatment. It helps draw water into the airways, which increases the surface fluid and kind of irritates the airway a little bit. And that triggers a cough reflex to help loosen and clear out those sticky secretions.
Oh, so it gives the airways a little nudge. What kind of device do you use to deliver the hypertonic saline?
We need to use a device that can create a high-density mist to make sure it reaches those smaller airways effectively, like an ultrasonic nebulizer.
Okay, that makes sense.
Yeah.
We've talked about a lot of benefits of aerosol therapy, but I imagine there are some downsides too, right? What are some things you need to watch out for?
Absolutely. Like with anything in medicine, cross-contamination and infection are always big concerns, especially with nebulizers that are reused.
Right.
We have to be super diligent about cleaning and disinfection.
Infection control is so important. What else should you be mindful of?
Environmental safety is another big one. We take extra precautions when using aerosols with patients who are immunocompromised or have contagious infections like tuberculosis.
Makes sense. You don't want those germs spreading.
Yeah.
What about challenges with the actual nebulizers themselves? Do you ever have problems with them?
Sometimes we run into issues with low aerosol output, which can be frustrating.
Oh, yeah, I bet.
With jet nebulizers, it could be due to low gas flow, a blocked tube, or even a misaligned jet.
How do you troubleshoot that?
With ultrasonic nebulizers, we check the power supply, the gas flow, the settings, make sure there's enough fluid, and that the transducer is clean and clear.
Good tips. What about the risk of overhydration? Can you give someone too much moisture?
That's a valid concern, especially with infants and small children, because they're more sensitive to fluid imbalances.
Right.
It's also a concern for patients who already have fluid or electrolyte problems.
So you're always monitoring for that.
Absolutely.
What's considered a normal daily water gain for an adult, just as a baseline?
About 200 milliliters a day is considered normal.
Okay, good to know. Any other complications we should be aware of?
In some cases, aerosol therapy can actually cause secretions to swell up, making them even harder to clear. And it can sometimes trigger bronchospasm, a sudden tightening of the airways.
Oh, that sounds bad.
Right.
What do you do if a patient has bronchospasm during aerosol therapy?
First, we stop the therapy right away. Then we give oxygen if needed and administer a bronchodilator to help relax those airways.
Wow, this is a lot more complex than I ever imagined.
It is. There's so much more to it than meets the eye, but it's really crucial for maintaining healthy lungs.
Yeah, I'm starting to see that. We've covered a lot of ground today, from those basic definitions to the ins and outs of these different devices, and even potential complications.
We have.
I think it's time for us to take a step back and kind of process everything we've learned.
Yeah, I agree. Let's take a minute to digest all this information.
Okay, sounds good. Okay, phew. My brain needs a minute to catch up here.
I know, right?
We've covered so much already, from the basics of humidity all the way to those super high-tech nebulizers.
Yeah.
What are the big takeaways? What should folks really walk away understanding?
Well, I think the most important thing is just remembering how crucial humidity is for healthy airways.
Right.
I mean, our bodies are incredible. They do an amazing job of naturally humidifying the air we breathe.
Yeah.
But sometimes they need a little help,
Absolutely.
especially when you're dealing with dry medical gases.
Right. It's kind of incredible how our system can naturally warm and moisten that air.
It is.
But it's also pretty delicate,
Oh, yeah.
If things get too dry, it can cause a lot of problems for those airways.
That's where humidity therapy comes in.
Exactly.
Whether it's a simple bubble humidifier or a more complex passover humidifier, we're essentially giving the body's natural process a boost.
Right. Just keeping those airways nice and moist and working properly.
Exactly.
And of course, always being mindful of potential complications like condensation, that rain out.
Right.
Overhydration, even infection.
All important considerations.
And let's not forget about those bland aerosols we talked about.
Oh, yeah, those are cool.
It's fascinating how those tiny liquid particles can deliver medication. Or even just hydrate the airways.
It really is a surprisingly versatile tool.
It is.
I mean, from soothing irritated airways to helping clear out stubborn secretions, bland aerosol therapy can do a lot.
We talked about all sorts of nebulizers too. Jet nebulizers, impeller nebulizers, even those ultrasonic ones that use sound waves to create that mist.
It's pretty wild how technology is being used in this field.
It really is.
But it's not just about the technology itself. It's about using that knowledge to make informed decisions about patient care.
Right. So it's not enough to just know the definitions.
Exactly.
We need to connect the dots and see how it all works in real life. Why should people listening care about humidity and aerosol therapy?
It's a great question.
How does it all come together to make a difference?
Well, at the end of the day, it's all about improving patient outcomes.
Right.
Understanding the science behind all of this allows us to make informed choices, as healthcare providers, and provide the best possible care.
So whether someone's dealing with a chronic respiratory condition or recovering from a procedure, this knowledge can help.
Absolutely. It empowers healthcare professionals to really make a difference.
So it's not just about knowing the facts. It's about using that knowledge to actually impact people's health.
Exactly. And that goes beyond just healthcare professionals, too.
Oh, really?
Yeah. Whether you're a respiratory therapist, a nurse, a physician, or just someone who's curious about respiratory care, understanding this can help you advocate for better breathing for yourself and others.
I love that. It's about empowering people to take charge of their respiratory health.
Absolutely.
And to understand the options that are out there.
Exactly. Now, here's where things get interesting.
Yeah.
We've talked about the benefits, but we've also mentioned some potential risks.
Right. It's not all sunshine and roses.
So, given all that, what are some things healthcare professionals should consider when deciding whether or not to use these therapies?
That's a great point. It's clearly not a one-size-fits-all situation.
Right. There are lots of factors to consider.
Like what?
Well, you have to think about the individual patient and their needs.
Okay.
Their underlying condition, their overall respiratory status, what kind of therapy they need, how long they'll need it for, and then, of course, any potential risks or complications.
So it's kind of like a puzzle.
It is. You have to weigh all these different variables to figure out the best course of action.
Can you give us some specific examples?
Sure. Let's say you have a patient who's on a ventilator for a while.
Okay.
You'd probably recommend a heated humidifier to keep those airways moist and prevent problems like secretions getting too thick.
Right, because those are hard to clear.
Exactly.
But you also want to be really careful about that rain out in the ventilator circuit, right?
Oh, absolutely. You don't want to solve one problem just to create another. And if a patient is already dealing with thick secretions, you might consider adding bland aerosol therapy with hypertonic saline.
To help thin those secretions out.
Exactly, make them easier to cough up. But then you'd have to watch out for potential bronchospasm.
Right, and be ready to adjust the treatment if you need to.
It's a balancing act for sure.
It sounds like it.
And that's why it's so important for healthcare professionals to stay updated.
Yeah, to keep learning about the latest research and best practices.
Exactly, because things are always changing in respiratory care. New technologies, new treatment approaches, we got to keep up.
It's all about that continuous learning.
It is.
So I have a little challenge for everyone listening.
Okay.
Think back to everything we've talked about today. What really stood out to you?
Yeah.
What questions are still swirling around in your head?
We encourage you to keep digging into this stuff. Do your own research. Explore those questions you have.
Yeah.
Talk to others about it.
Right.
And stay curious.
Keep that curiosity alive. After all, every breath we take matters, right?
It does.
And understanding how to optimize our breathing can make a huge difference.
You know, it's funny how we often take breathing for granted.
We do.
Until something goes wrong.
Yeah, we don't really think about all those complex processes that are happening every time we breathe in and out until we have trouble breathing or a cough or something like that.
And then suddenly you're hyper aware of every breath.
Exactly.
Every little wheeze and crackle.
And that's when all this stuff we've been talking about becomes so vital, right?
It is. That's when respiratory care steps up to the plate.
It really helps us understand these problems and figure out how to manage them.
Exactly.
It's amazing to think about how much science goes into something as basic as breathing. We've covered the physics of airflow, the principles of humidity and aerosol generation.
It's a lot.
We talked about the anatomy and physiology of the respiratory system and all the mechanisms behind these therapies.
And honestly, we've only scratched the surface.
Really?
There's so much more to discover.
Oh, wow.
Research is ongoing. There's tons of innovation happening.
It's exciting to think about the possibilities, isn't it? What trends are you most excited about? What does the future hold?
I'm really intrigued by the development of personalized medicine in respiratory care.
Oh, yeah. We touched on that a little bit earlier.
Yeah. Imagine treatments that are specifically designed for your unique genetic makeup.
Wow.
Lifestyle environment.
So we're talking about actually addressing the root causes of these problems.
Exactly. Not just managing the symptoms.
I think AI is going to play a huge role in that whole, personalization revolution.
Oh, absolutely. Imagine AI algorithms that can analyze your breathing patterns.
Okay.
Look at your medical history, genetic data.
Wow.
All to predict your risk of developing certain conditions or recommend the best treatments for you.
That sounds almost like science fiction.
I know, right? But it's becoming our reality.
It really is. It's incredible to think how far we've come.
It is. And it's all thanks to the incredible dedication of researchers, clinicians, engineers, all the folks who work tirelessly to improve respiratory health.
Absolutely. It's really inspiring. As we wrap up our deep dive, what's one final thought-provoking question you'd like to leave us with?
Here's something to think about. As technology keeps advancing and we learn more about the respiratory system, how can we make sure that everyone benefits from these innovations?
That's a big question.
It is. How do we ensure that access isn't limited by location or economic status?
Access to quality healthcare is so important. It's a right, not a privilege.
Exactly. It's a challenge, but I think it's one we can overcome if we work together.
Yeah, if we collaborate, prioritize innovation, and stay committed to improving respiratory health for everyone.
Exactly.
Well, this has been an incredible conversation.
It has.
Thank you so much for joining us today.
Thanks for having me.
We hope everyone listening learned something new.
I hope so too.
And came away with a greater appreciation for all the amazing work being done in respiratory care.
Absolutely.
And remember, keep learning, keep asking questions, and most importantly, keep breathing.
Keep breathing.
You know, it's amazing when you think about it, breathing. It's something we do without even thinking.
Right.
But it turns out to be incredibly complex.
It really is. We've covered everything from the basics of humidity and how our bodies deal with it, all the way to those cutting-edge technologies like ultrasonic nebulizers.
Right.
And AI-driven personalized medicine.
Yeah, and we talked about those critical moments when breathing becomes a problem and people need help. And that's where respiratory therapists and everyone in this field come in. They're like the superheroes of breathing.
I like that the guardians of our breath.
Yeah.
It's a huge responsibility.
It is.
And as we've seen today, it takes a lot of knowledge and skill.
Absolutely.
A deep understanding of science and technology.
Right.
And especially the unique needs of each patient.
What really struck me was the importance of balance.
Yeah.
Finding that sweet spot with humidity, the right aerosol therapy.
Right.
All while trying to minimize risks. It's not easy.
It's definitely a balancing act.
It is.
But that's also what makes it so rewarding. You're always learning, always adapting to new discoveries and new technologies.
Speaking of new technologies, what are you most excited about? What does the future of respiratory care look like?
Well, one thing that I'm really excited about is the development of smarter, more personalized ventilators.
Oh, wow.
Imagine a ventilator that can adjust its settings on the fly.
Right.
Based on the patient's breathing patterns and needs in real time.
That would be incredible.
It would make a huge difference in their comfort and recovery.
Absolutely. And we touched on the potential of AI earlier.
Yeah.
Can you talk a bit more about that?
I think AI has the potential to completely transform how we approach respiratory diseases,
Okay.
that we diagnose, treat, and even present them.
Wow.
Imagine an AI system that can analyze a patient's medical history, their genetic information, even things like environmental factors and lifestyle choices,
Yeah.
and then use all of that to create a personalized risk profile.
So we could know if someone's at risk for developing a lung condition.
Exactly. It would be like a crystal ball for lung health.
That's amazing. We could intervene early and maybe even prevent those conditions altogether.
That's the goal. Early detection and intervention are key.
Absolutely. This has been an incredible deep dive into humidity and aerosol therapy.
It has.
As we wrap up, is there one final thought-provoking question you'd like to leave our listeners with?
I think it's important to remember that even with all these amazing advancements in technology, we have to make sure everyone can benefit from them.
That's a really important point.
So the question I would ask is this: how can we ensure that these innovations are accessible to everyone,
Right.
regardless of where they live or their economic situation?
That's a huge challenge.
It is, but I believe we can solve it by working together.
I agree. Access to high-quality healthcare is a fundamental human right,
Absolutely.
and that includes respiratory care.
Well said.
Thank you so much for joining us today for this fascinating exploration of humidity and aerosol therapy.
It was my pleasure.
We hope you learned something new
I hope so too.
and gained a deeper understanding of the vital work being done in the field of respiratory care.
It's amazing work, for sure.
And remember, never stop learning, never stop asking questions, and keep breathing.
Keep breathing.
Until next time, stay
Yeah.
curious.